So Terry, we're here talking about the bilirubin meter. Can you tell me why it's an important piece of equipment?
The bilirubin meter is important because it allows us to screen babies for jaundice. We can do a visual assessment, but it's not as reliable as having a number. And so by using the meter, we can assess baby's level of yellowness. And the reason why it's so important is that there is a condition which can lead to serious neurological problems if that bilirubin level gets too high and rises too high too quickly. And so by using this screening tool, we can assess whether or not these babies need to be revisited by a physician, have subsequent testing, and maybe treatment for that so we can prevent those problems.
That's wonderful. How has the bilirubin meter helped you in your role?
Well, the bilirubin meter has helped us in our role in that when babies are discharged from the hospital, it's the public health nurses that go out and visit those babies for the first 10 days, 2 weeks of life. And it gives us another screening tool in order to assess whether or not these babies could become at risk for developing a jaundice that could be problematic.
Wonderful. Why did public health come to the foundation to ask for this piece of equipment?
Well, we were not having the resources to be able to utilize this tool. We would use our visual inspection, and we'd have other assessments that we would do, and we'd look at risk factors for babies who may be at risk for developing jaundice that could be problematic, or jaundice that would require readmission and treatment. And so the physicians understood that there was this transcutaneous bilirubin meter and asked why we didn't have it. Well, it wasn't in our funds to be able to afford this piece of equipment. And so they said, well, if we were able to get this piece of equipment, would you be able to use it? And we said, absolutely. We're trained to use it. We just don't have the equipment. And so together with the physicians who we work closely with, we were able to request some funds, and we got those meters. So
awesome. In your opinion, what is the most important work that the Taber and District Health Foundation does?
Well, being able to raise funds and then release them to the local programs that really could use it so that we can purchase these items that we wouldn't otherwise get within our operating budget.
Awesome. Why is it important to support the TDHF?
Well, as I said, the equipment was available, but we just didn't have it here locally. So being able to provide those resources to our local programs is so beneficial.
Awesome. Thank you for your time.
Thanks, Vicki.